Hi, welcome to our show. Hey, if you have a relative or if you're in need of some sort of home health care, you have a lot of questions to ask. And with me today to answer his questions is Dr. Ed Hoffman, who's a family practitioner, general practice, and Alisa Sigman, who is the owner of Integrity Home Health Care. Alisa, you know, people reach a certain age or get a certain point in their health where they need some assistance. And when you're dealing with this for the first time, you don't know where to go, what you're entitled to, what you need. How do you, you're in the home health care business, right? How do you make these decisions?
Well, it's really not as easy as you would think. I actually just experienced being in the hospital recently as last week, and it's not as organized as it used to be. So when you go to the hospital, let's say for the first time, and you haven't seen a physician, you don't maybe have a primary care physician, and they say, oh, well, you're going to go home, but you need some help. You know, you have a choice at that time to ask the case manager at the hospital who you'd like to go to. Most of them, unfortunately, don't know who to tell you to go to because they're not as familiar with the home health care agencies as well either. So it's kind of like, okay, well, is it A, B, or C? So really, some of our patients need to do some homework, you know, beforehand, but know that they have a choice. Know that they want to pick a reputable company. So they need to ask the right questions.
Right, and so when you're making that choice, what are the right questions to ask?
Well, the right questions to ask would be, you know, where do most of the patients go when patients are choosing? To ask the case manager possibly that, or who would you recommend? Who are some of the agencies that you know that do the right care? Because I know our company's been in town, it'll be our 10-year anniversary this year, and we've worked very hard to find the right people to work for our agency that really make sure that our patients are taken care of in the home and communicate with their physicians correctly.
Can you go through what are some of the differences of the services? Like you have, when you say home health care, it encompasses somebody, I guess, from staying at your house for a number of hours each day or maybe even overnight to somebody just visiting occasionally throughout the week. How does that work?
Well, we do skilled services. So I'll have a nurse, a registered nurse go out and see you, or a physical therapist come out and see you, and it could be anything from you going to the hospital and having a knee replacement and needing to go home and have some physical therapy done until you can go and drive yourself physically to a rehab facility, to you have a much more severe diagnosis and you need to be at home on infusion antibiotics. You know, most of the things that they do in the hospital, the best news that you can hear is that you can do it at home. And we all know that we get better at home much more than we do, you know, in the hospital setting. So.
Well, yeah, and that's a good point. You know, being at home is always a lot more comfortable. Now, as a physician, you know, you see and you work with home health care organizations to monitor the patient's health, correct?
That's correct. I have like 30 homebound patients currently, and what I've found in my many years here in Las Vegas, I've come across many different home health care agencies, and specifically why I like Integrity is, and as she pointed out, the nurses and that she's contracted with, I find I have good communication with them. They email me, they text me, they fax me. So maybe if I'm seeing a homebound patient in between the maybe 4 to 6 weeks that I don't see them, I'm getting weekly input of how they're doing, and that's something I haven't experienced before with other companies.
And what's a typical scenario when you have a patient that needs home health care? What is a typical type of ailment, and what is your role as the physician?
The commonest ones that I've been seeing that are homebound are stroke patients. And they're released from the hospital where maybe they've done some inpatient rehab, but they're not back to where they're functioning at a, I won't even say 100%, but at a point to where they can function outside of the hospital. So they're getting nursing supervising their vital signs, their blood pressure, their blood sugars, which is very important. They're getting home physical therapy, where they're, kind of re-strengthening, or most people following a stroke have a problem with balance and the strength in their limbs, so they're getting physical therapy to recondition them and practice their walking, leg strengthening, and progressive ambulation. And this can go on for months after you're discharged from the hospital, and yet these people are, can't really drive someplace themselves, and so they're kind of homebound, and yet you can't let them with the home health care agency, they're getting their therapy that they need within the confines of their home. So eventually they will be improved to the point where they can function on their own.
Alisa, when you go into the hospital, you know that there's a great variety of care that you could receive from any particular nurse or physician, for that matter. I mean, there's some really excellent, nurses. We've all had those experiences, and we've had, unpleasant experiences as well. How do you decide, or when you screen or vet your RNs? I mean, what are you looking for?
Well, I've been very fortunate. We have some of the best registered nurses, I believe, in town, along with my whole entire staff, from physical therapist to speech therapist. But I think it goes back to just like you are in the city. Mm-hmm. You've been around a long time. People start hearing about your company and what you do for your patients and for your employees. And when I started my company 10 years ago, my number one thing was to make sure that I treated my patients as well as I treated my employees, which were to make sure that they felt that they, were part of a company that really did care about people. And so I think that's how, over the years, we've obtained, the best staff in the valley. So I think that has to do with it. But they do go through a whole criteria of screening. There's mm-hmm. quite a bit of orientation that goes on. We do it for weeks at a time to make sure that they're informed, because I need to make sure that our staff, when they go out to see patients, they don't have any I don't know questions, so they're able to answer all the questions for our patients, and that's how we represent our company.
And you work closely with the labs in town. I mean, I guess a lot of what you do is, getting labs, taking, blood, that type of thing. And
absolutely.
Yeah.
We have partners with everyone in town. It's amazing the things that we can do in the home. We can take x-rays in the home. We have a company that'll come out and do x-rays. We can do labs in the home. We can do so many different things now, that can be ordered and actually be done in a home environment where you don't have to leave and go to the hospital and sit there for hours, to do something like that.
Oh, nice. Yeah. I had a situation recently where I had a doctor pull out a little echocardiogram. It was mm-hmm. about fit into my hand, and just pulled it out and connected it, and and did a test.
It's amazing.
Right there. Yeah.
We're app friendly now. You can do so many things in the home. It's just wonderful, actually. Technology is a great thing.
Yeah, and this, obviously, people are getting older. More people hopefully now have insurance under the Affordable Care Act. Mm-hmm. So, I mean, it's going to mean more business, I would think, right?
Well, I imagine so, yeah. Yes, but I think the most important thing, if anything, comes from, us communicating today, is that I would love, if people have questions, there is no magic number. The problem is there's no magic number for a person to call to just ask the questions that they had. And so what I'd like to, inform people is, call our company. You may never need home health care, but if you have a question, that's what our company is in town to do. We're here for the long haul. We want to help people. So if you need to have durable medical equipment, if you need to have home health, if you need to have a physician, whatever you need, please call our agency, because that's why I started the company 10 years ago, is because I want to help people get the information that they need, because it's just overwhelming what people tell them and what actually is the actual truth.
Did you arrange for the medical equipment as well? I know, like IV pumps and that type of thing.
Absolutely, we coordinate with companies for all of that. We have infusion companies that'll make sure that the DME is durable medical equipment. A patient can get their walker. We can coordinate that for them, get that set up in their home. And I feel we partner and have been partnering. Like I said, I've been in the community for over 20 years now, but 10 of these years have been owning Integrity. And I think we've partnered with the best that really know to take care of the patient and do the best that they can for the patient.
Yeah, in the roughly 40 years that you've been in town. And
thanks for aging me. Thanks for giving out my age there. Okay, go ahead. But yes, 40 years.
And been a physician. You've seen a lot of the protocols change. I mean, I can remember, 30, 40 years ago, you had let's say a heart attack or something like that. I mean, the idea was to keep somebody in the hospital, keep them rested, keep them lying down after a surgery. It's different today. You want to get people up and home,
and out,
right?
Yes.
Yeah.
You see, when I first started, you had a heart attack, you were probably in the hospital for at least 7 to 10 days. And now, as soon as you're able to get up and walk and your condition appears stable, you're out the door. And that's why I think it's so important that you either have a home health care company that you feel comfortable about, or you have a physician who's willing to come and see you at home if you're not able to get to their office. And that's kind of a lost art in medicine today.
Yeah, you think that's coming back? You know, now, and I know you do this as well. Some of this concierge medical practice where you actually go to patients' homes because obviously, look, people can't get out and about so oftentimes. And when you do get out and about, you're in a waiting room for an hour and a half.
I believe that the concierge concept is really about patient care, not about business, so to speak, but it allows the doctor to spend time with patients. It allows, I do, as I mentioned, I have 30 homebound patients. I go to their homes. It allows the physician to be a physician. It's more, to me, that's what it's more about than a business concept, and allows the doctor to practice medicine instead of practicing business. And that's what most doctors got into medicine, to be a doctor.
I know you deal with particularly a lot of elderly patients,
Yes.
and then as you age, you need additional care,
Right.
and then you need additional precautions with flu shots and shingle shots, and what is the recommendation with some of this now?
Well, the flu shots, there's more than one. For elderly people, there is now a higher, a more potent flu shot that will be more available next year. There's also where the traditional flu shot was 3 flu viruses, A and A, B, and a variation of 2 types of the B. Next year there's a 4 quadvalent vaccine, and the higher dose it has for older people. So you're really going to have to question which flu shot you're getting, and should I not be getting this one instead? Also, older people, and I guess I fit into that age group now, is that they have a shot for shingles. Anybody who's ever experienced shingles knows that that pain can persist for months and months after the rash is gone. And so there is a shingle shot that is also readily available.
That's recommended for anybody who's had chickenpox, right?
Well, yeah, well, chickenpox and shingles they're basically the same thing, but when you have chickenpox as a younger person, it gives you a partial immunity, and later on in life, as your immune system is challenged either through age or other illnesses, you're more likely to break out in shingles, which is a painful rash along a nerve root, and as I said, that pain can be quite unbearable. So if you can prevent it by doing a shingle shot, why not? And as far as there's always potential complications, but in the patients that I've done the shingles vaccine with so far, I've had no other issues.
To ask you also about antibiotics. I mean, you hear both sides. Hey, antibiotics are important, but now we have all these strain-resistant bacteria that they're not treating. Don't take too much. How do you balance that?
Well, being somewhat old school, there's the art of medicine, and you can pick and choose when somebody comes in. Whether most illnesses the doctor sees are viral and really don't respond to antibiotics, but sometimes you got a sense in the patient. Okay, if I just say, okay, Ed, you got a cold, see you later. You need to offer something, and there's a time and place for when antibiotics, or if you think there's secondary infection, if you feel that maybe it is a bacterial, a doctor can do in his office a strep throat antibodies test. Takes 10 minutes to do and determine whether they have strep throat. You can do a flu test also, where you swab the nasal passage and put it out and map it out on a little like a reagent strip that you have, and it will tell you if you have flu or not, so whether you need to treat them with Tamiflu or these anti-flu agents, you can do that in an office today. So I feel that it's a doctor decision whether or not antibiotics are necessary, and I think that you have to kind of evaluate the whole situation whether or not you feel they'll be beneficial. There is the concern that they're being overused, and probably so. But it's really kind of your decision with the doctors, what is right for you at that time.
Alisa, do you also work, I was just, it's dawned on me that oftentimes, and I know I've had this in my family, where family members had surgery and they're in the hospital, but you just wanted them to have 24-hour care in the hospital, so you can hire a nurse from the outside to come and sit with you in the hospital and help.
We have partners that work with us. My company, again, does more of the skilled side, but that's where the partnerships come into play so much, is that we have partners that actually have companies that send nurses out to sit with a patient, actually in their home, in a hospital setting for a period of time that will do that. Unfortunately, our company doesn't do that, but I believe in doing one thing and doing it really well, but I partner with all the other companies that do their one thing and do it really well.
And how do you know, I mean, look, a patient gets released to go home and they have specific instructions that they're released with and protocols, and how do you know what those are and whether you're performing them or helping the patient perform them appropriately?
Well, usually in the hospital setting, unfortunately, you have one or more, usually quite a few hospitalists that see you based on their specificity, like their cardio. You have a cardiovascular surgeon, you'll have all sorts of different types of physicians. That's the complexity of them coming home and then seeing if we can get all the physicians to communicate. Because it's not the way how it used to be in the past that you guys talked about, where you have that one physician that takes care of all the care anymore. So what we do is when you come into the home, we try to find out all the physicians that you have been working with. So do you have a primary care physician? Do you have a cardiovascular physician? Do you have, and then we make sure that all that information goes back to the primary care physician and all the other physicians are communicated with, because the one physician may order medicine and the other physician may order medicine, but they may contraindicate. So we need to make sure that everybody's in the same loop working together.
And therein lies the most frustrating part of medicine.
Absolutely.
It's just that not having one person in charge. I mean, you go into the hospital and you have these hospitalists now, and as you said, they're from different specialties. One left arm doesn't know what the right arm is doing oftentimes.
All the time. And so that's what we try to do, is bring it all together. That's the most important thing. And if I may go back just a few minutes when you were speaking about getting the patients out of the hospital faster. I'm sure you're aware of the Affordable Care Act and what was passed. And now the hospitals are trying to discharge the patients as quickly as possible. The hospitals are being penalized if the patients come back to the hospital within a certain period of time, because they're not being able to recoup any monies. So it's more necessary than ever before for the hospitals to work with home health agencies, because over 53% of the patients that get discharged need some sort of care in their home. And so that's why I think this forum is so important, for people to understand that you can call. We may not be the person that can do it all for you, because we're only contracted with certain insurance companies. We may not have the contract with you may have Aetna, and maybe I don't have that contract. Right. But I work with companies that can steer you in the right direction to make sure that you go to the best agencies in the valley.
But if you are on Medicare, then you do have these choices and options, correct?
Absolutely. Yeah. Absolutely.
Yeah, and it's an old saying. I'm not sure exactly what the words are, but if you're sick, a hospital's no place to be. I mean, the idea is to get somebody out of the hospital.
Agreed.
I say nothing good happens in a hospital.
Yeah, exactly. My daughter had a situation a couple weeks ago at a local hospital where. And she was having some IV issues, and the nurse came in, and my daughter speaks up for herself. Can you please put gloves on? And the nurse refused to do it. We've since filing a complaint with the hospital. But I mean, there's things like that in 2014 you would think that are just aren't happening anymore, but they are.
Right. Absolutely. Like I said, I was in the hospital last week, unfortunately, and I was under observation. But for 3 hours of under observation, I was actually just laying in the middle of a hallway, and I didn't have anything hooked up to me at that time. And I thought, well, I don't know who's observing me besides me. Yeah. So I really think that.
Well, you call your office, give me one of your nurses over, right?
Yeah. I called him.
Yeah.
I said, get me out of here. I need to go home. I can do much better at home. So.
What is a registered nurse compared to a nurse, and an RN compared to a nurse or a physician's assistant? What's the difference in all these?
Well, a registered nurse is, a nurse with a set of skills that is, under the state they only can do certain things. Then we have licensed practical nurses that can do different things, from a registered nurse in the home setting as well as in a hospital or anything else. A physician's assistant is someone that works with a physician. Our company specifically has nurses, registered and licensed practical nurses. We have physical therapists, occupational therapists. We have speech therapists, which is awesome for the stroke patients that need that help in their home, because a lot of times they've had, problems with their speaking, and so we can do that. We also have certified nurse assistants to go out and help with bathing needs, especially if you've had the stroke or anything else. And I don't want to just allude to that one diagnosis, because we can do so many different things, But we do a little bit of all that, And like I said, just one call does it all. And in my opinion, call us and we will help you do whatever we need to do to get you to the right people that you need to get to. It isn't about my company. It's about information to people. And just like, we want to make sure that people take care of themselves.
Yeah, I mean, it's just such a confusing time for people.
Absolutely.
And so do you start with your physician when you're...
And I believe that, you start with, it's important to have a primary care physician that knows you. Like when my patients, I've known some of my patients 30, 40 years. If something happens to them, like Alisa was in a hospital, she calls me. If necessary, I will go over there. I don't do hospital. You used to be on a staff for several hospitals, and now you have the hospitalist. But I still can go over to the hospital, make sure you're getting the care that's necessary, and when you're discharged, as she does, coordinate the care that you've had in the hospital with what's going to happen once you're home, and review all the records. And I think it's important that a doctor gets the hospital record, reviews the records, sees the patient, makes sure the patient's followed up by the proper specialist, but still has that one doctor who knows them and knows everything about them.
And preventative measures, I mean, there's still the old basics, diet, exercise, physicals, that type of thing.
Well, prevention's always better than waiting till you're sick.
Okay.
And watching your diet, exercise, which is, not everybody's an exercise person, but still trying to maintain some degree of health by being conscious of the foods you eat. The certain supplements can be preventative. Most people the internet has surprised so much information about so many things, and to each his own, more or less, that certain people will look up, okay, I think I'm going to take this supplements, but it is something also they should discuss their conditions or what their concerns are with their physician. And hopefully the physician is knowledgeable not only about traditional medicine, but I call it complementary medicine, about the supplements and vitamins that might have some help in disease prevention.
Yeah, and that's important, because oftentimes, and people take this lightly, the interactions between supplements and medicine, as well as food and medicine. I was on some medicine recently, and you couldn't eat grapefruit,
right?
Because it would affect the medicine.
With your heart medicines, yes.
Yeah, and so you have to be really careful, because you don't know, particularly on supplements and vitamins, what you're taking and what the interaction may be.
Well, one of the things currently in medicine is that you have to have a certified, I don't know if you have to have, but it's certainly recommended and supported by the government, a certified electronic medical record. And what that does, for instance, if I order medicine for a patient and there's potential interaction, it alerts me to this. And in the past, you kind of hope the pharmacist might tell you about it, but it will alert me to any interactions between prescription medicines, supplements, or anything that might be prescribed for the patient. And I think this is one of the benefits of electronic medical records. I was a little resistant at first, but
you see the benefit.
I see the benefit now. Plus, they can read my handwriting.
And how do you keep up with this? I mean, there's new drugs coming out every day. Right. At one time when you started practicing medicine, you knew essentially all the popular medicines and their interactions. Now with the onset of so many new drugs, is there a little, internet, flag that pops up when you're taking two that don't react well?
I can once again don't need to tell you what I do. There's a website, Medscape. And it has all kinds of medical information for family practice, all the different specialties, and it has certain alerts when new medicines come out, or the FDA limits certain medicines. And so I try to, a doctor always has to continually learn. I mean, it doesn't stop from the day you finish medical school. You're always learning. There's new medicines. There's medicines that are now indicated for something that they weren't indicated before, and you just have to, keep on top of it. And the internet is a great resource for that.
Yeah.
Plus the courses that you take periodically.
Yeah, it's so elaborate anymore that and it's so complicated. What's the very first thing a family should do? Getting out of the hospital, they had say stroke, they need some home health care, they need some physical therapy. Very first question you should ask, and to whom?
Well, I think they definitely should talk to their primary care physician. Hopefully they have one. I think that's the most important thing. I don't know if you would agree or not, but everybody has to communicate. I think that's the most important thing. I hate to keep going back to our company because, there's a lot of information that's out there. People may have a relationship with their certain physician. I would strongly recommend that if you do have a relationship with your physician, that's the best person for you to talk to is the person that you trust the most. We talked a little bit about the insurance and the Affordable Care Act and the Nevada Co-op and Obamacare, is going to happen. And I hope that if anything happens, that more people will have insurance and have the opportunity to start obtaining primary care physicians, because that's really where it starts. You need to have that one central hub, if you will, or person that all the information goes to make sure that you get all the care that you need.
Yeah, and we have only like a minute left, but how long does home health care last? I mean, how long will insurance companies pay for that?
Well, it depends, but I've had patients on service for a few years. Mm-hmm. It can go anywhere from a 30-day period to 60 days, all the way up to a couple of years. It just depends on what their needs are.
You have to get it pre-authorized, so you need to take that step with your insurance company as well.
Absolutely.
Right? Mm-hmm. Well, thank you so much, Alisa Sigman from Integrity Home Health Care. And Dr. Ed Hoffman, it's always good to see you again. Dr. Marcus Welby of Las Vegas still make house calls.
For those who don't know what Marcus Welby is, you can Google that. It's just one other thing. He keeps on trying to show my age. Okay,
yeah.
Thank you so much.
Well, unfortunately, I know who that is too.
So yes, okay.
Yeah, he's not here anymore, though.
Okay.
Well, thank you both very much. This is important decisions that you need to make, and it's a very confusing time for people. So, hey, do your homework and make the right decision, as Lisa and Dr. Hoffman are talking about. We'll see you next week.
Be sure to visit us online for more information about today's guests. To see past shows or even contacting us about being on the show, simply go to theedbernsteinshow.com. That's theedbernsteinshow.com.